Hello, everybody. This is Dr. Tyler Evans from Arete Chiropractic. We're coming at you live today talking about the Cranio Cervical Junction, why it's so important. The paper I'm reviewing today is called, right here, Cranio Cervical Junction, Embryology, Anatomy, Biomechanics, and Imaging in Blunt Trauma. Why that's important? Well, so the Cranio Cervical Junction, or the cranium, which is skull or head, right? And then cervical is the neck below. And then the junction between the two is this right here. This is it. So it's the occiput, C1 and C2. And this guy right here is literally the focus of our practice at Arete Chiropractic because of everything that goes through here, right? And so it's really, really important. Now, that starts out very early, and that starts out right away because when the upper neck, or the CCJ, is developing in the womb, the CCJ is actually one of the most anatomically diverse areas and is most prone to malformation and asymmetries. And so when it comes to having an injury in the CCJ, it's very, very important that we look at that in 3D and do that in a way that has high resolution. So a thing like a CT scan or an MRI is very, very helpful in diagnosing and finding out what's wrong with the craniocervical junction. Now, why would we do that? Well, in this paper, they're talking about blunt traumas, and they don't really describe exactly what level of blunt trauma they're going after. But in my opinion, any trauma to the head or the neck is one in which you might want to have your neck checked out because of the importance of that CCJ and what's inside of it. So what they talk about in this paper is that the teaching points are the craniocervical junction is a distinct osteoligamentous entity with specific functional demands. Understanding the embryology of the CCJ may prevent erroneous radiological interpretations, and this paper is more directed at people who look at imaging all day long, like MRI or X-ray or CT scans. Dedicated MRI sequences can provide accurate evaluation of ligamentous integrity and injury, as well as injury of the CCJ carries risk of blunt traumatic cerebrovascular injury. And so I think one of the coolest things about the CCJ that I've learned over the years, the craniocervical junction, is that it is not held together like the rest of the spine. So the rest of the spine have these big discs right here. Normally, this is between C2 and C3, where the vertebra below have those big discs. But C1 and C2 are held together, as well as to the skull, by all this ligamentous structure. And so what we see here, down here, is the same thing on the inside. This is on the inside. This is a cutaway. We have more than 8 or 10 ligaments that hold that whole area together. And they're quite strong, and they're made to withstand forces. However, specific forces and directions can actually damage those ligaments. And the muscles can fail that hold the structure outside of that. And so what happens when that happens is we get misalignments in the CCJ. And so this compounds itself with all kinds of problems that we can see develop early on. I'm pulling up a picture here of some of the variants that we see in people. Sometimes they may not have a fully developed atlas like this one. This is the C1 bone. So that's actually this bone right here in the picture. It's sliced this way, this way, right? So it's coming up from the bottom this way. But you can see that sometimes it may not fully fuse, and this is actually a small one. Sometimes it'll be a much larger non-fusion, as well as we can get, so like on the back of it here, a non-fusion there, or we can get these little extra pieces of bone that grow in there that might attach the skull to the atlas itself, or this is another direction here. And so it's really important that we have specific imaging like cone beam CT, which is what we do in our office here. And a lot of the upper cervical chiropractors are starting to move towards taking cone beam CT and advanced imaging, especially when they can't figure the problem out. And so if you're having trouble with headaches, neck pain, migraines, any problem on the inside of the body as well, because of all the nerve structures that go from the brain down to the body, they have to travel through this hole, right? And so any structures below, in the intestines, in the heart, in the immune system, and any of the systems down below, they might need a second look at the spine, and that head-neck relationship can be a big part of that if there's been an injury in the past. So again, this paper just talks about how the craniocervical junction gives rise to at least 50% of the range of motion in the neck, the flexion, extension, and rotation back and forth. But it houses all that nerve flow between the brain and the body. And so, I think this paper does a really good job of giving all the nitty-gritty details. So if you want to have a look through it, it's got some fantastic pictures of problems in there. The other thing is we have, so here we have problems where the cerebellum, or the base of the brain, can actually sink down into the C1 and C2 area. And those are called Chiari malformations. That can happen. We can also have vascular problems where the blood flow can be interrupted by the jugular foramen, the jugular veins coming out of the brain, as well as the arterial flow up into the brain. That's all right around the CCJ. So if it's a blood pressure problem, that can be coming from the CCJ. A concussion type problem, that can be coming from the CCJ. And this paper just discusses why it's important to have advanced imaging in the upper neck, and have somebody that knows how to read that stuff. An upper cervical chiropractor does that for a living all day long. They look at that advanced imaging, as well as a radiologist. And we have in our office here a relationship with a guy named Matthew Richardson, where he reads all of our imaging to make sure that we're not missing something, because in 3D there's a lot to see. And so we've always got a second look by a radiologist for our imaging, and we do that specialized cone beam CT imaging, because it's important when you're looking in the CCJ. It's a very, very complex joint. It needs a special look, and sometimes a second look even. So it's really important to get it checked out. If you've had head or neck trauma, head or neck injury, whether it be a big one or a small one, getting that neck checked out by an upper cervical chiropractor would be a really good idea. Because oftentimes, and this paper doesn't really talk about the chiropractic perspective of it, but even in the medical world, there are things that can be missed where we're looking at very, very small misalignments in the upper cervical profession. I mean, we talk about 1 millimeter of displacement or 5 degrees of rotation, right? And so these small misalignments, they're a big problem, and they can have big effects on how the body works. But a medical professional may not look at that. They look at fractures. They look at some of these anatomical variants that are listed in this paper, and that's great. But there's other things that go on in there, and upper cervical chiropractors look at that. They take their time and really, really see if there's a problem elsewhere that might be going on in the CCJ. So if you have questions about that, if you've heard that word thrown around, if you're concerned about your health, please give us a call. Our office is a Retake Chiropractic in Portsmouth, New Hampshire, 603-380-9184. If we can be of help in any way, let us know and get that CCJ checked out. Have a great day. Bye-bye.